How can you treat swelling in your knee if you have osteoarthritis? Hello, this is Dr. Siddharth Damber, expert in regenerative medicine and in rheumatology. In this video, I'll be talking about the following. Why does swelling occur in your knee when you've got osteoarthritis? What exercises can help to treat that swelling? What supplements can be helpful? What foods can be helpful? And also, what regenerative medicine treatments can be useful as well? And lastly, what treatments you want to avoid long-term if you've got swelling in the knee. So why does swelling in the knee occur when you've got osteoarthritis? So in general, when we think of arthritis in the knee, we think of inflammatory arthritis or degenerative arthritis. Inflammatory arthritis means that your body's immune system is overly acting, attacking the joints, and causing swelling in the joint. That's a condition of total body inflammation. On the other hand, degenerative arthritis is a process where you've got instability in the joint, which then leads to stress on the cartilage, friction on the cartilage, and eventually damage to the cartilage and swelling because of that kind of damage as well. The key to understand is that while in inflammatory arthritis, you have total body inflammation and inflammation in the joint, in degenerative arthritis, you can still also have a milder degree of inflammation. So in research studies, when they look at, are there any levels of inflammation in the joint in wear and tear arthritis, what you find is that there are mild elevations of certain inflammatory cytokines, or the kind of chemicals that you see in inflammation as well. So there is a mild degree of inflammation that does occur in wear and tear arthritis, and that is what causes swelling in the joint. The other thing that causes swelling in the joint is instability. That is what degenerative arthritis is about. You've had a strain in a ligament, it gets a little bit overstretched, it's now no longer quite as tight or as strong as it should be, that then leads to a little bit of instability in the joint, and progressively over time, that eventually leads to wear and tear of the cartilage, and then eventually also inflammation and swelling in the joint as well. And then in addition, keep in mind also that your metabolic health makes a big difference also when it comes to swelling in the joints as well. So by metabolic health, I mean how well controlled is your blood sugar, and in turn, how well controlled is your overall inflammation in the body. So we know that folks who are running higher levels of blood glucose, whether they're pre-diabetic or diabetes, have higher rates of inflammation as well. We know that folks that are more prone to other types of metabolic syndrome issues, such as obesity, fatty liver, high blood pressure, early heart disease, all those things also lead to chronic inflammation as well. So there's a connection between your metabolic health and inflammation that also can drive swelling and pain in the joint as well. So how do you treat this? There's a number of conservative things that you can do. There's some things that we can do medically, and then I'll talk about some things you want to avoid. From a conservative standpoint, there are exercises that you can do to help out with the pain and swelling in your knee joint. So if you can strengthen the muscles around a joint that's arthritic and painful, you can help to stabilize it, which then in turn will help to reduce the amount of stress on the joint and thus inflammation that develops in the joint as well. In the case of the knee, you want to strengthen, in particular, not just the leg muscles, but also the hip muscles. Strengthening the hip muscles is really key. In your normal gait cycle, you transition from hip to knee and back and forth. If there's any degree of weakness in the hips, it leads to more stress on the knee and the knee having to carry more of the weight and the struggle of carrying your gait as you're moving. And the issue is that in this modern world, we tend to be a little bit more sedentary. That then leads to a little bit more weakness in the hips, which is then leading to more stress in the knee as well. So strengthen the hips, very important. In addition, you should be allowed to do any exercise as long as it's not causing that kind of pain and swelling in the joint. But keep in mind that there may be certain high impact exercises that may be more challenging. So if you're able to run and your knees feel fine, wonderful, keep on doing that. On the other hand, if every time you run or do some other high impact activity, you find that your knee gets swollen, that's likely a sign that there's too much stress on the knee. You then need to adjust that activity. You don't necessarily need to totally cut it out, although that may be necessary. You could also reduce the intensity, reduce the number of miles that you're running, reduce how fast you're running, or even change up what sort of surface that you're running on, anything to help reduce the overall stress on the joint. And then lastly, also consider doing exercises that are less impactful on the knee itself. I'm a huge fan of swimming. Great activity to do if you've got lower extremity arthritis and pain in the knees. Great way to still get a great cardiovascular workout, great way to still strengthen the muscles as well, and great way to help manage exercise if you've got a painful swollen knee. Next are supplements. When it comes to joint swelling and pain, there's two in particular that I recommend: omega-3 and curcumin. Omega-3, which comes from fish oil or flaxseed oil, in high enough dosages has been shown to help with pain and swelling in rheumatoid arthritis and in osteoarthritis. And so if you've got chronic pain and swelling in the knee, omega-3 is a great one to consider. And the other one to consider is curcumin, also known as turmeric, which in studies has been shown to help with pain, swelling, and dysfunction in knee osteoarthritis. So two good supplements to definitely consider. Food is another key one here. To begin with, if you're not at an ideal weight, you want to try to optimize that as much as possible, and food is certainly a big part of that. Nutrition is a key part of that. The reason why is any extra weight that you have is putting significantly more weight and stress on the knees. And anything to help reduce that weight on the knees will go a long ways to helping out with the pain and swelling in the knee as well. Keep in mind that the food that we eat can also make us more prone to inflammation. So we know that folks who are obese, that extra adiposity, those extra fat cells can lead to more inflammation on its own. Also, we know that the food that we eat can also make us more prone to inflammation, in particular food that tends to have a higher glycemic index, meaning food that tends to increase our blood sugar level. So the American College of Rheumatology, when it comes to chronic inflammation, in particular people who've got chronic inflammation conditions, recommends a Mediterranean diet. Generally, that means focusing on legumes, vegetables, and protein sources such as meat, chicken, and fish, and avoiding high carbohydrates, and also avoiding red meat or minimizing red meat, and avoiding highly processed foods because they tend to have higher levels of fructose, which can then increase your blood sugar levels, which again then leads to more metabolic issues. So from a food standpoint, there are definitely things that you can do to help treat the pain and swelling that you have in your knee as well. Next are regenerative medicine treatments. So regenerative medicine treatments include treatments like platelet-rich plasma, your own bone marrow-derived stem cells, and prolotherapy. Safe treatments that help to treat stability and inflammation. So when it comes to treating stability, treatments like prolotherapy and platelet-rich plasma for treating your ligaments, strengthening the ligaments, improving stability of the knee joint are really helpful and very good at treating that kind of instability issues. Regenerative medicine treatments can also treat the chronic inflammation you have in a joint. Rather than platelet-rich plasma, I would recommend a treatment like platelet lysate. Platelet lysate is where you take the platelet-rich plasma and you crack open the platelets and you just take the growth factors. That tends to be less inflammatory than platelet-rich plasma, and you're still getting the benefit of the growth factors from the platelets. In addition, there are certain anti-inflammatory chemicals that we have in the body that can be isolated. Those include alpha-2 macroglobulin and interleukin receptor antagonist protein. Both of those can help with chronic swelling and pain in the knee. Also, bone marrow concentrate stem cells from your own body are helpful as well for treating the chronic swelling and inflammation as well. And the reason why is because they have high levels of alpha-2 macroglobulin and interleukin receptor antagonist protein. Some treatments I would recommend being cautious for if you're using a long-term for knee pain and swelling would include anti-inflammatory medications and steroid injections or oral steroids. Now, the reality is that those treatments do help with inflammation, but they're meant to be used only for short-term use. Short-term, let's say you've had a sprain of your knee and you've got some temporary swelling in the knee, taking an ibuprofen or Aleve can help with the discomfort and the swelling short-term. But if you've got chronic knee osteoarthritis that gets swollen from time to time, utilizing these kind of treatments like steroids or anti-inflammatory medications is not the right thing to do. For starters, it's not helpful for the tissue long-term. And in addition, we know that it's not really helping to fix what the actual metabolic problem is. It's not helping to fix the chronic inflammation long-term. It's not helping to fix the instability long-term as well. Combine that with the side effects that you get with these kind of treatments, You want to be careful about using those chronically. Only utilize those short term. Should not be using those for chronic management of the pain and swelling in the knee. Well, to sum up, knee swelling and knee osteoarthritis, super common. It's due to instability as well as inflammation. You can utilize exercises, supplements, foods, and regenerative medicine to help treat these issues. There's some things like chronic anti-inflammatory medications and steroids that you want to avoid utilizing for chronic pain and swelling in the knee. And we can get this better with safe, lower risk treatment options. Thank you for your time. Please give us a like and subscribe to the channel. Until we meet again, have a good day and live well. Bye-bye.